Hello and welcome back to Mexico News Network's Breaking News. Stay informed 24/7 by logging onto our website on www.mexiconewsnetwork.com, and also don't forget to follow us on social networks on Facebook, Google+, as well as Twitter. You'll find us as Mexico News Network. Now let's continue with more information. After 38 years of research, scientists of the National Autonomous University of Mexico, led by Lurival Domingos Posani, have discovered two new ways to employ scorpion venom for the benefit of public health. What the team in fact found was a brand new procedure to take advantage of the peptides contained within the venom. These little proteins are used by the arachnid not to harm others, but to protect its organism of bacteria. This makes the peptides an ideal antibiotic, even more effective than those currently in use. This new antibiotic, currently being reviewed by the Food and Drugs Administration, the FDA, has shown to be greatly efficient in the lab when interacting with certain viruses, fungi, as well as bacteria, such as Escherichia coli. According to Domingos, the development of this new antibiotic will improve public health, with it's currently affected by the increasing inefficiency of antibiotics, which are often provided in large quantities, compromising the health of the patient's other organs. The second use attributed to this poisonous substance is its effect on human lymphocytes, which could prevent the development of autoimmune diseases such as diabetes type 1, psoriasis, and rheumatoid arthritis. In other news, according to the World Health Organization, the WHO, as well as the Mexican Diabetes Federation, in the world there are more than 347 million people with diabetes, of which 6.4 million are located in Mexico. In fact, this disease is the second cause of death in the nation, mostly due to resulting cardiac or renal complications and infections. Other consequence of diabetes is a very slow healing of wounds. People with this condition are very vulnerable to chronic lesions, especially ulcerative types in their lower extremities. To decrease the number of amputations and infections resulting from this, Miriam Veronica Flores Merino, a doctor of the Autonomous University of Mexico State, has developed a polymeric skin substitute as an alternative for diabetes patients. Created at the university's Research Center for Medical Sciences, this improvement is literally a patch that is applied to wounded skin and helps the patient regenerate and scar over the tissue in about a month. This is possible because the patch is made of two polymers, polyethylene glycol, which makes the patch biocompatible with humans, as well as chitosan, a component that makes cell regeneration possible. According to Dr. Miriam Veronica Flores, studies have shown the effectiveness of the patch, and so far there have been no negative consequences in humans. She has also claimed that this improvement can be used over superficial wounds or burn injuries. Before Dr. Flores' research, Mexico's National Polytechnic Institute, the IPM, had developed a substitute for the regeneration of skin using mesenchymal stem cells. However, the material was costly and its lifetime was very short compared to the patch designed by Dr. Flores. This medical alternative will improve the quality of life of many diabetes patients. The Mexico State Health Institute has stated that 25% of diabetics are affected by ulcers and amputations. As a matter of fact, complications from diabetes represent a $3 billion cost per year for medical institutions all over Mexico, which is a number that is hoped will decrease when the patch comes into full use. Now, a joint collaboration between specialists from the U.S. and Mexico resulted in a great remedy for one of the most devastating diseases, which kills 75,000 a year. Prior to this treatment, there was no way of preventing cancer, with early detection being the only chance of ever overcoming it. There is now new hope that, thanks to specialists from Washington University and the National Cancer Research Center of Sonora, that this is the first drug capable of not only preventing the formation of malignant tumors, but also of preventing a relapse for patients who have to go through treatment. Now, cancer is a very silent enemy that diminishes health, often without noticeable symptoms. This causes the patients to seek treatment, sometimes when the illness is at a very advanced stage. Juan Pablo Marquez, an oncologist at Washington University and head of this binational project, explained that some of the deadliest types of cancer are colon and ovarian, which is why the first application of the drug aims at prevention. According to Marquez, this vaccine stimulates the immunological system, making it react metabolically against malignant cells, which in turn allows the body to eliminate them. The drug has proven to be efficient even with the hidden cells known as pre-malignant, which are cells that are highly susceptible of developing into cancer. Now, approximately $20 million have been allocated to the study of each tumor. But the fact is that research, which started 14 years ago, is delivering unprecedented results, as 400 Mexican cancer patients who overcame the illness and submitted themselves to this treatment haven't shown any further signs of relapse. The scientists believed that in approximately 5 years, this treatment will be part of the conventional vaccination record for children as well as adults for the disease. Researchers from the National Autonomous University of Mexico's School of Chemistry have found a way to improve the chemical processing of a group of compound called imidazoles, which is the key component in drugs prescribed to treat allergies, fungal infections, as well as arterial hypertension. Professor at the university, Juventino Garcia, explained to Mexican daily Milenio that imidazoles are organic compounds present in many medical substances, such as antibiotics. The regular process to obtain this chemical component is very expensive and quite inefficient and tends to cause pollution. What the UNAM researchers have done is to simplify the process by using raw materials such as nickel, which have a lower cost than the materials normally used. While these materials might not be entirely clean, they are used in quantities that are much lower in quantity and therefore in environmental impact than traditionally used substances. Professor Garcia added that they have started this project following the latest global trend of green chemistry. They are in fact also very much interested in discovering new generations of antibiotics and medicines that do not generate resistance in patients. This method has already been patented, and researchers believe that it can be used to create other chemical intermediaries, as well as applying it to the preparation of other materials. The goal is to introduce more effective, green, and economic processes for the pharmaceutical industry. Sadly, this was all for today. Thank you so much for staying with us and joining us, broadcasting directly from the beautiful El Dorado Royal Spa Resort by Charisma, an adults-only, gourmet-inclusive hotel located in the heart of the Riviera Maya. Now, don't forget to stay informed 24/7 by logging on to our website, www.mexiconewsnetwork.com, and also don't forget to follow us on social networks on Facebook, Google+, as well as Twitter. You'll find us as Mexico News Network. I am your host, Elisa Carballo, and we will see you next time. Audio Jungle. Audio Jungle. Audio Jungle.